The Trump administration is withdrawing $5 million worth of ads for Obamacare, planned for the final days of open enrollment. The Health and Human Services Department says it's a money-saving move. Obamacare supporters call it sabotage. It comes as Republicans are taking a close look at several specific plans to replace Obamacare. Chief Congressional Correspondent Mike Emanuel goes down the list tonight.
Just about every Republican wants to replace Obamacare, but the challenge is doing it right and quickly. California Congressman Tom McClintock expressed concern to his colleagues at the Republican retreat, according to the Washington Post. Quote, "That's going to be called Trump Care. Republicans will own that lock, stock, and barrel, and will be judged in the election less than 2 years away." While Tennessee Senator Lamar Alexander urged members to focus on long-term solutions, lowering costs, saying, quote, "Our goal, in my opinion, should be not a quick fix. We can do it rapidly, but not a quick fix."
I think the president is open to whatever we can pass that solves this problem. This is not the Republicans' problem. This problem was caused by the Democrats. We feel an obligation to fix it, and we're committed to fix it.
Dr. Tom Price, President Trump's nominee to lead Health and Human Services, has been offering a conservative approach. Price would fully repeal Obamacare, would offer tax credits based on person's age rather than income to help buy policies in the private market. Grants to states for high-risk, older and sicker population. The concern is his plan might not insure as many as Obamacare. Another medical doctor, Senator Rand Paul, has offered his own plan in recent weeks. Paul's plan focuses heavily on tax credits and health savings accounts. It would abolish many of the central components of Obamacare, and it would encourage allowing inexpensive insurance.
Get rid of all the Obamacare mandates and let people buy whatever kind of insurance they want, and that will drive the prices down.
The most moderate alternative has been offered by Maine Senator Susan Collins and Louisiana Senator Bill Cassidy, who also happens to be a doctor. Their concept would give states the option to keep Obamacare, choose a new state alternative, or design a solution without federal assistance. It would scrap the individual and employer mandates. Some suggest it's too close to Obamacare. One expert says the key for Republicans is setting realistic expectations.
I think the big hang-up for them is to not get into the trap of rolling back coverage. If they end up with a plan that leads to many millions of more people not having health insurance, they could really end up in a political cul-de-sac from which it would be hard to extract themselves.
Leadership sources insist the replacement is not going to be a 1,000-page bill. They note some things will get done in the repeal process, which requires a simple majority vote. Sources say big changes will come by the Trump administration scrapping thousands of pages of regulations, and then the final component would be bills that will require 60 votes in the Senate, with reforms that sources predict some Democrats will support. Brett?
Mike, thank you.